Okay, so good morning everyone. Myself Dr. ANUJ GABA. I'm also an FMG like all of you, and today I'm here to give some tips and tricks to all of you on how to pass this exam. So, just as an introduction, I passed this exam in the previous exam and I got 198 out of 300. So, maybe what I learned during the procedure, I will let you know, which might really help you to pass this exam too. So I would like you all to please take a pen and a paper and please start writing these things. These are just 10 points that I just want to highlight, which you should just keep in mind while you're always practicing and learning for this exam. So first point and the most important point to all of you is that do not leave any subject. That means any subject. So you have to study all the 19 subjects that are there in the syllabus. There is no shortcuts that you can take for this exam. After this, the second point that I would like to tell all of you is that read all the PYQs, that is the previous year question, for all the past 5 exams. Okay, at least once all these questions should have been through your eyes. Now, you should be already focusing on clinically oriented questions, because now a lot of questions are not straightforward, are not one liner. They're going to be a little twisted, and that twist is just the clinical ideas that they give you. You need to find a diagnosis, you have to find the procedure, you have to find what is given. So it's easy. If you just keep on doing some questions, you will get to know about it. Now, a very important point to all of you is that you should have to focus on the image based question. Like example I have given below, that what is this maneuver, is it the jaw thrust maneuver, or is it the Heimlich's maneuver, etc., etc. You should know which maneuver looks like what also. Not just remembering the name is enough, you should also be remembering the image. Then now you should have to read your whole notes. Now why I'm saying that read your whole notes, because now the questions are not coming like a single question, it is integrated. Now anatomy is integrated with the radiology and surgery, like pathology is integrated with the pharma part. So FSM is integrated with the biochem part. So the questions don't come just from one subject, they also try and target 2 or 3 other subjects. So please read your whole notes, your whole lectures, because integrated questions cannot be solved by leaving a subject. Now, do not just rely on chanting and rapid revisions. I know a lot of you might be thinking that that was your hope, that was your way of doing some minor subjects, but my very honest advice to all of you is that do not just rely on chanting and rapid revisions, because they are just to boost your information but not to act as a primary source. You have to understand that a chanting will only help you if you know something already. If you do not even know the ABCD, what is the use of remembering the spelling of pseudopodia? Maybe he will not ask pseudopodia, maybe he will ask something else. So you should know the basic first, and then you should go for chanting and rapid revisions. Now, the most important and the golden point of this video, it's a very short video, that you have to solve at least, I'm saying at least 100 questions, that is daily. And after solving these 100 questions, make sure to note your mistakes. Now, how should you note your mistakes? Is that first, was it my silly mistake? That means, अरे यार ये तो आता था but ये गलत हो गया. That is a silly mistake. Second, I don't know what the F is this. That means that यार ये कभी पढ़ा ही, I don't know where is this asked from. ये subject भी समझ नहीं आया कि किस subject से पूछा गया. So that is the second criteria of the mistake. And third is, यार ये कुछ कुछ आता था और कुछ कुछ नहीं. That I knew a little bit of it, but I didn't know a lot of it. So that is the third category of mistake. Classify them in these 3 categories and then work on those separately. Now, there is no time to get demotivated. That's why I've kept this video very short, because we still have a time, but it is running very fast than we think. So it is not too late to buckle your seat belts and put a pedal on the accelerator and go. Now, a very important information for all of you, that I am going to start my own Telegram channel with this name, that is Dr. ANUJ GABA for medical. I am also on my Instagram, that is @it's me Dr. GABA, and I am also having this YouTube that you are watching this video on, that is Dr. ANUJ GABA FMGE. In these 3 platforms, soon, very soon, I will start posting questions, important topics, and a lot of things that you should know before you give this exam. So make sure to take a screenshot of this slide, make sure to scan these QR codes, and you will be able to join my Telegram and my Instagram. And the last one is for my YouTube. Make sure to go there and subscribe so that you are not missing anything. Thank you so much. So Please make sure to comment down and let me know which topic should I come next with. Thank you so much.